Hi, good morning.
Good morning. How are you doing?
I'm good, and how are you?
I'm good, thanks. It must be very early where you are, I think.
Yeah, it's not too early, but it's like around 9 o'clock a.m.
Okay.
Yes,
Okay, so it's morning time for you over there in Trinidad.
it's morning time, yes.
Okay,
And you?
here is 2 o'clock in
Okay,
the
okay.
afternoon in
All right.
London. Okay, thank you for accepting to do the interview, first of all. It's,
Yes, no
it's nice
problem.
to get different perspectives from different countries as well, just to see
Definitely, yeah.
how people from different countries are dealing with thalassemia as well, compared to other
Yeah.
countries and ourselves as well.
Yeah.
So, if you're ready, we can start the interview. First of all, if you don't mind introducing yourself and just saying who
Okay,
you are,
sure.
where you're from.
Okay. Yes, my name is Shenelle Maharaj, for those of you who may not know me. I am 24 years of age, born and raised in the beautiful Twin Island Republic of Trinidad and Tobago. Um, I am a beta thalassemia major patient, and I was diagnosed when I was approximately 13 months old. Um, I am an executive member of the Society for Inherited and Severe Blood Disorders in Trinidad and Tobago as well.
Okay, that's
Um,
great. So, going on to
yes,
some of the points that you just mentioned, you were diagnosed at 13 months, you said.
yes.
Did your parents know about thalassemia before you were diagnosed?
No, actually, my parents had no clue what thalassemia was about. Um, my mom, she told me that she first heard of the condition when I was diagnosed, actually. So I guess it was like a new learning experience for everyone in my family. So
Okay.
yeah.
How did they find out that you had thalassemia? Did they go to the
Um,
doctor or to your doctor or something?
I yes, I was diagnosed. It was actually a day that my parents they had taken me to our local health center to do like a pediatric checkup and vaccinations done. And at that time, there was a nurse whose care I was under, and she noticed that I was looking very, very pale. So she told my mom that we need to run some blood tests on this child immediately, and so they did, and they discovered that I had like a low HB level, um, and then they proceeded to do more tests and screening, and eventually diagnosed me with thalassemia major. So from that point forward, I started receiving blood transfusions at least once per month um, through the pediatric unit.
So you go once a month. Do you have any others, brothers or sisters, that have?
Yes, I have.
Do they
I
have?
have
Yeah.
one older brother, and he has a thalassemia trait. Um, so it's minor. I'm the only major.
Okay. You mentioned that you're involved with this with the Thalassemia Society of in Trinidad as well. Um, what what was the reason that you got into working with the charity?
Um, I I think it was like I just wanted to build a network, with the thalassemia community and learn more about people living with thalassemia and about their experiences. Um, so I wanted to become very involved in it and just work together with the society to see what's the possible ways that we can improve the treatment here for our patients. So I've been serving on the executive for about a year now.
So it's a year that you're
Yeah.
working with
Well, I have actually been a member before that, but then they asked me to be an executive member as well. So
Okay.
that's
So for me, I've been working for 3 years with the Thalassemia Society as a board member myself, and I have
right.
thalassemia myself as well. So it's nice
Okay.
to see how are they running? How is the society running? And what's the aim of the society?
Well, the society actually advocates for people with other IBDs as well. So like sickle cell and hemophilia and so on. Um, so we basically just advocate and try to raise awareness as much as possible about these conditions because thalassemia and the other disorders, they are not something that is at the forefront of healthcare, I would say, in Trinidad. Um, so as much as possible, we try to do events throughout the year to raise awareness and also assist the patients as much as possible in terms of obtaining medication and making sure that their treatment and management is going well.
How is the medication and the treatment itself? Do you have enough blood over there, especially in the
Um,
months and even before that? How is the medication wise and the blood itself for your transfusions?
One of the major challenges actually that we have is the availability of blood because our national blood pool, it has been in a crisis um, for some time. And especially during this COVID-19 pandemic, it's a little bit more difficult to access blood whenever it is needed. So, as a society, we also try to encourage persons to become a registered voluntary blood donor and try to host or conduct as much blood drives as possible um, to ensure that we have like a steady supply. But it has been a challenge. Um, in terms of the medication, I think it has improved over the years in terms of accessibility. So there is no major challenges faced with that at this point in time. But
Okay,
definitely the blood supply.
some countries I've heard that there needs to be a donor to be able to. So for each blood they receive, someone else needs to give blood. Is that the same in where you are, or there is whenever there's a supply you can get it regardless of someone donating blood for you or not?
Yeah, well, we do have a voluntary system. So usually we would get blood whenever it is needed, but they do encourage us also to bring donors on our behalf. Um, so in my little circle, in my family or my friends, I would try to encourage persons to donate on my behalf as much as possible as well.
So the same here in the UK as well. Someone doesn't
Okay.
have to
Yeah.
donate blood, but there's encouraging just like that.
Mm. Yes.
Okay, so that's great. Another thing was that on your day-to-day basis, in your day-to-day life, is there any challenges that you go through, and how do you cope with your thalassemia on a daily basis with the medication and going to work or to study, taking the time off for your transfusions? How do you cope and manage with that?
Um, I think I have been working together with it as best as I can to manage my condition. I try not to let it keep me back from achieving what I want in life. So, I try to, well, thankfully, I've had like employers who understand my condition and they are able to give me the necessary time off whenever I have to go to my doctor visits and so on. So, it's not so much of a challenge in that regard. But I try, for myself, I try to go as much as possible to maintain my blood count level at 10 or above so that I don't run into problems of, feeling fatigued or weak very often. Um, because sometimes, that in itself is like a bit of a struggle to get up and feel tired every day, and then have to go to work or go to school.
So your employee doesn't
So
have any problems when you've mentioned that you've had thalassemia. So you've mentioned it from the beginning, or has it been a gradual thing mentioned?
yes, yes, I told them upfront right away, that I have this condition and this is what it requires of me, and I need to have blood transfusions every month and so on. So they understood from the beginning, how I had to manage it and what I needed to do. So I'm thankful for that.
Because there's been many cases that I've heard of people that have not been able to tell their workplace, their employee, and they've had to take annual leave to be able
Wow.
to actually go to their appointments. So it's good that
Yeah.
you've been able to actually tell them and they've understood. Do they fully understand what thalassemia is and what you have to go through every time
Yeah.
for your transfusion? Or then they don't really understand it that well?
I guess they don't really understand the condition, but I try to explain it as simple as possible, for them to understand how it works and what is required, because I think that's promoting awareness as well, you know. So in every environment that I go, I try to I be open about my condition and try to educate as much as possible so that they have a better understanding of it. Yes, so
That's good. So you're trying to bring the awareness more to people as much as you can. So
as much as I
not
can,
just in
yes.
the environment of the society that you work with, so outside in your workplace as well. How about your colleagues?
Yeah,
Are they aware that you have thalassemia as well? The people,
yes, they are.
and they know that
Yes,
you have to miss days for that reason.
yeah, and they have also been very supportive because even when I would go for like treatment or to my doctor visits, they would like call or message and ask, hey, you doing okay? Or how did your treatment go? Or something like that, So they check up on me from time to time as well to make sure that, everything is going as it should.
So looking back when you were growing up, how was it for you growing up and with your friends as well, playing with them with the medication and everything like that? How was it dealing
Um,
with your friends with the medication and your friends at the same time?
yes, well, I think in my younger days, the iron chelation therapy were not very accessible here in Trinidad. So I never had like the pump to go to school with. Usually I would just, if I have to use it, I would take it like on the evening when I get home. Um, so they never really knew about that part, I guess. But it has been a challenge in terms of my schooling, um, where I where because of the days that I missed for having to go for treatment or to my doctor visits, that time away from school kind of had me at a setback, sort of. So I had to bring myself, up to speed, and but I was determined nonetheless to do what I had to do to push through and move on to the next level and graduate and so on. Um, so it has been a challenge in that regard with regards to my schooling. But my friends, like my close friends, they understood um, what the condition was about because I would try to explain it as much as possible
So sticking
to
with
them.
when you were growing up, how was it for yourself taking the medication? How did you find it taking the medication? Did you feel like
I
did you feel like this is something that I shouldn't be taking it, looking at the other people that didn't have to take it? Or mentally, how was it for you as well?
Yes, I actually, struggled with I guess compliance at some point in time too because I had really bad side effects from the medication. Like I would get really bad nausea and feel sick. So it was a challenge having to feel that way and then go to school or go to work or that kind of thing. Um, but I knew that it was something that I had to do, so I tried to do it as much as possible because I feel like that's the only way out. And I obviously do not want to suffer the other complications associated with iron overload. I'm still battling with trying to reduce it, but I am pleased to report that I have been actually doing much better than I were like a few months ago. Um, it has reduced significantly, and I hope that it continues to trend down. And I know that, once I keep doing what I have to do with regard to taking my medication, that it will continue to trend down. So.
For the thinking back to when you were younger and having difficulties with your medication, what would you tell all the young people who are looking at the Instagram live now to the interview or later on when they look back?
I'm sorry, I did not hear that question very clearly. Someone was trying to call me.
Um, what I was saying was thinking back to when you were younger, to what you just said about you having difficulties with the medication and things like that, what would you tell the young um, generation looking at the interview now, or the ones that will look at it later on? You have a message to tell them.
Yes, I would say follow the advice of your doctor as much as possible because they know best in terms of the management of your condition. Um, and I would like to also encourage everyone to educate yourself as much as possible about your body and how it works, understand how it functions, why you have to take your medication, why the treatment is necessary. Whatever condition you may have, just educate yourself as much as possible with regards to that because there is a wealth of knowledge available and easily accessible now with, internet access to everyone. So uh, definitely educate yourself and do research as much as possible with regards to your treatment and how you should manage it. Um, and I also think um, it is important that you have a strong network of people whom you can um, go to for advice. So, like being a member of the society, I think that really helps to learn from people's experiences and so on. And and it's also important that you have a strong support circle um, of your friends or family, to help you on your good and your not so good days.
So being able
um,
to speak openly with them and
Sorry.
so being able to speak openly with them and get help from
Yes, yes. Be
advice.
open about it and help them to understand what you're dealing with. Um, so that because I have friends too who might actually like they would go and research for themselves about thalassemia and find out what it's about, and then they would ask me how I'm coping or how I'm doing, and from time to time that really I guess goes a long way in the end. And I appreciate those who have decided to do that. And also for everyone who is experiencing and just see your obstacles as just a challenge that you're going to overcome, and it's only going to make you stronger and give you a greater story in the end. So definitely believe in yourself and count your blessings, because I think we are able to do, so much things that some people don't even have the opportunity to do at, at some time. So yeah.
Definitely. That's one of the things that in the UK Thalassemia Society, we always try to get across. So as long as you are taking your medication and you're doing your transfusions, how you're meant to be doing them, then you can achieve
Yes.
pretty much anything as long as you
Yeah.
go forward and attempt
Yeah.
it,
Definitely,
especially
you could
with
live
the
a pretty much normal life, and
exact
accomplish everything that you want to. Just put your
exactly,
mind to it and do what you have to do. Yeah.
especially with the younger children who they haven't seen much in their life and they see that
Yes.
their friends will have to take all the medication and missing days.
Yes.
Uh,
Definitely.
was there any achievements that you have succeeded in, anything that you've succeeded in throughout your life that you are grateful for, that has helped you to move forward in your life beyond the fact that you have thalassemia?
Um, I actually, celebrate the smallest of things in life. So just the fact that, I'm able to wake up every day and be able to go to work or pursue an education, um, or just hang out with some friends from time to time. Some people, like I said, don't even have that opportunity. So I'm really thankful, for being able to do all of that and still live a somewhat normal life, despite the challenges faced with thalassemia. And I think one of my most recent victories regarding my health actually, um, is that reduction of my iron level, like I was saying before. Um, to me, I was like so ecstatic about that, because I hope that it continues to trend down, and be maintained, at a normal level eventually. So for me, I would celebrate those little things as well.
Going back to when you were younger and in school, was there
Hmm.
anything that you weren't able to do, whether it was physically or something mentally that you thought that you weren't able to do at school, or you were missing out because of your illness, because of thalassemia?
Yeah. In terms of my physical ability, I would say, like I've never seen myself to be very athletic. Um, so
Do you
I
think
never
that
really pushed myself to, try out for any sports team or clubs or anything like that. Um, I would just look on, but I um I never pursued that sort of thing in my school. I would take part in like physical education activities, but at times I would feel like, I don't think I can do this, because um, so I never really ventured down that road in terms of sports and that sort of thing.
do you think that that is linked to psychologically linked to you having thalassemia, or just you think yourself you weren't able to do sports and things like that?
Yeah, I feel like it probably would have been psychological as well, because there were times that I said, okay, I don't think I can do this, because I know how I'm going to feel, but like I didn't even really try it out to see how I would feel. So I just tell myself that I probably can't. Um, but I don't know. I guess I was never really I guess so interested in sports as well to take part in a lot of activities. So
So especially now, with COVID and things like that, is there any challenges that you face with your medication or actually going to your transfusions, having your transfusions,
um they
especially in the
well they
area
have
that you are in?
my area not so much, but I live in South Trinidad and I actually have to travel to North Trinidad to have my treatment and so on done. So um it's probably like about an hour
So how
drive.
long? Okay, so it takes you an
Yeah,
hour to
about
go there and then back. And you said
yes,
you go every month
every
for your
3 to 4 weeks
transfusion.
approximately. Yeah. So
3 to
yes, so
that
the only
generally.
challenge I would really say is the availability of blood at this point in time. Sometimes it's not available. Like recently, I went about 2 months without a transfusion, but thankfully my HB level was kind of like 11, and then it started to drop. So it was maintaining itself at that level for some time. So I was able to extend the period of time that I needed for my next transfusion.
Would you
But
would you say that that example that you gave of you not being able to go for your transfusions for 2 months, that one time for because of lack of blood at this specific
mhm.
COVID time, would you say that is generic for a lot of people in your area in Trinidad, or is just specific for yourself that it just happened to be like that at one time?
Yeah, I've known of other patients who have probably went like 6 weeks without a transfusion because the blood was not available. Um, so it's just really a matter of like when it's available because they don't really prioritize giving units of blood to thalassemia patients. They would see you with a blood count of like 7 or 8 and say, well, okay, well, that's still okay. So you could, you know, um, be at that level for some time long, like a little bit longer. Um, but I guess you would understand why it's important that we try to maintain that blood count level above 10 or above at least, uh, to avoid any other complications. So it is a challenge in that regard at this point in time, but um, and usually like when I go for transfusions now, I would receive at least 2 pints of blood. Now I'm getting like 1 unit, so I have to go a little bit more often sometimes. So as opposed to every 3 to 4 weeks, I sometimes have to go every 2 weeks to ensure that I get the sufficient supply. And
Okay.
I think that's the situation for most of our thalassemia patients at this point in time.
Is that just in one center or one hospital, or is that in many areas, you would say is
I think it's nationwide um, in terms of the blood supply. It's been affected a lot of patients nationwide as well.
okay. So here,
Yes,
thankfully, because we need blood to stay alive in the UK, thankfully they
yes.
prioritized us as being in need of blood, so high priority for blood. So
Oh, that's great. I hope that we get there someday in Trinidad as well.
really, so we're
Yes,
at terms over here. There are There are, like I mentioned before, other places that I've heard people talking about where there needs to be someone that donates like a unit of
yes.
blood for them to receive 1 unit of blood.
Right.
You have
Yeah. Sometimes that's the case. I think even in my younger days, actually, my parents had to try and source donors in order for me to get a pint of blood. But I think over the years it has improved, and they have encouraged a voluntary system. So people usually voluntarily donate so that there's a blood pool um, ready to distribute whenever it is needed. But um, again, due to the challenges faced with the pandemic and so on, not much people are donating currently. So
within
it's important that we encourage people to do so.
within the charity that you work with, are there any
Yeah.
special projects or campaigns that you're doing to try to tackle this, to try and encourage more people to donate blood?
Yes. Um, we are actually trying to plan like we normally have a which walkathon every year. Well, this year we weren't able to have one um, due to COVID-19, but we're trying to plan events to try and promote awareness. And in that, we also encourage persons to donate. And apart from that, throughout the year, we also partner with other organizations as well to conduct blood drives throughout the nation. Um, so that is done from time to time as well.
Okay, what was the most recent project or uh, sort of thing that you did with the charity?
I think the last thing that we did was a blood drive, and we partnered with at my hospital actually that is in North Trinidad. Um, so we hosted a blood drive a couple months back, and we were able to get I think about close to 100 units, I believe. So that was really good, but we need to organize more and more of that um, through all parts of Trinidad.
Is your charity based in one area, or you have people from different areas working together within the charity?
Yes, it's Trinidad and Tobago, so the whole entire country. Persons are from all over. Yeah.
Okay, so you more or less can get information about what's happening in different areas and
Yeah.
need and things that are happening in different areas.
Yes, and we usually host like monthly meetings with all the members of the society. So we usually have discussions and so on about current events and how people are dealing with it in this time and so on. And we try to help as much as possible
I
in terms of the
also
education.
also understand that you've been working with TIF, Thalassemia International Federation as well.
Well, yes, I do well through the society. Um, it's heavily involved with this. So whenever they have events, they would ask for representatives from Trinidad as well. So I try to take part in that as much as possible.
Have you been a representative on behalf of the Trinidad Society for TIF?
I've not as yet. I was supposed to be a representative last year um, to attend their global conference that they usually host every year, but my grandma passed away in the same weekend, and I was not able to attend. So I think they are having a virtual conference this year. So I plan to be a part of that. Yeah.
That's great. Was there any national activities that you've done inside Trinidad and Tobago to create awareness?
Yes, we usually have well on World Thalassemia Day we normally do a lot of events to promote the day and to promote awareness. So we did have social media campaigning and so on done for World Thalassemia Day, but we don't have a national thalassemia day as yet in Trinidad. So I'm hoping that that's something that we can do as well
Like,
going forward.
some-
That would be great because I'm really liking the idea that you guys have that, and I think it's important that we do something like that as well.
yeah, it could be something that you discuss,
You consider, yeah,
that you
yeah,
consider
definitely,
discuss between yourselves to
yeah,
create awareness with other people that don't have thalassemia within Trinidad and Tobago.
yes, definitely. That would be a great idea.
Yeah. How do you think people that don't uh, have thalassemia, don't know about thalassemia, how are they actually finding out about thalassemia or actually hearing what you have to go through and you explaining what thalassemia is?
Yeah, most of them are surprised. Like some of them still do not even hear of the term thalassemia. So it's usually like a shock when you explain, the condition. Um, but I hope that we can break that kind of unawareness. um, but it's really something that we have to educate our population about because I think it's something that is very common. Um, you know, persons have the trait and they may not know. Um, and we try to implement newborn screening as well, so that babies can get tested um, when they are just born to determine if they have a thalassemia or the parents has a thalassemia trait. So
Just touching on that, what you were just saying now, do you usually, is there sort of something set up for parents to get tested before they want to have a child or before they get married? Because there are some countries, not that many, that, for instance, Turkey, before
right,
they get married, they need to get tested for thalassemia. In the UK, that hasn't been set up as of,
no,
but in Trinidad, or
no, we haven't had anything like that as well. Um, so it's only really through um, education we try to tell persons that it's important that you get tested because you can get tested if you choose to, but there's nothing set up to make it like a mandate or a mandatory thing that you have to get tested before you get married or have a kid or anything like that.
okay, so it's the same as
Yes,
UK. So
yeah.
once
Much people
child,
much people don't hear of the condition until after their child is born, and then they realize, well, they have a thalassemia major child, which is unfortunate, but
yeah. So once
we're trying to avoid that going forward.
once the child is born, and if the child has thalassemia, how easy is it to actually, if you've heard or seen, or from your own experiences, if your parents have explained, how easy is it once the child is born and the parents find out that their child has thalassemia, how easy is it for the child to start having transfusions and have medication?
Um, I think it's relatively easy because even through the pediatric units at our hospitals, we, well, I was treated through the pediatric unit when I was a child. So getting, in terms of getting transfusion and access to medication and so on, I don't think it's really a challenge once you discover that you have a thalassemia major patient. Um, it's just a part, it's just making sure that you keep your appointments and go to the doctor as regular as possible. And then we also have the hematology units at some hospitals, so they go directly to the hematology units to have their treatment and so on.
Okay, that's great.
Yeah.
When the child changes the units from that adolescent unit when they become a teenager and they go um, to the adult unit, what age do they usually transition?
They usually transition at about 12 to 14 years old.
Okay.
I think I transferred to the adult hematology unit when I was about 14 years old.
How did
Um,
you find it? How was the transition for you?
for me, it was much better. I actually um, preferred going to the hematology unit directly rather than having to get treatment through the pediatric unit, uh, where you just have like a consultant coming to visit you there. But um, with the hematology unit, it's really just for hematology patients. So I think it's a more direct focus, and the treatment and care is really centered around thalassemia patients and other patients living with inherited blood disorders. So it was an easier transition for me. The only thing um, is in terms of my commute. When I used to get treatment through the pediatric unit, it was actually at the southern part of Trinidad in the hospital at South. Um, the hematology unit that I currently attend, it's in North. And one of the things that we were able to do as a society is to have the hematology unit implemented in South as well. So that has recently came on board. Um, so with time, we're hoping that patients from the southern part of Trinidad can also go, and they already do. Whoever was there before, they already have access to treatment in South. Um, but it's just now, and like me who lives in South but was getting transfusion in North, I have the option now to transfer from the North hematology unit to South. But I've kind of already, I guess, got comfortable with the nurses there and with the doctors there. So I guess it will take some time for me before I decide to transfer um, to the southern part of Trinidad.
Would it be closer, you were saying, if you were to transfer?
If
It's
would it be
commute.
sorry?
Would it be a closer commute for you if you transfer over?
Yes, definitely. Yeah. It would be probably like 20 minutes from where I live as opposed to an hour and a half.
Okay, but you're
So
saying that the level of treatment and level of care is better where you are now. So you're willing
I think,
to go.
yeah, I feel like I've it's just because I've been comfortable getting treatment there over the past couple of years. You know, we've built a sort of family in the hematology unit. So it's kind of hard to part from them if I have to relocate elsewhere. But I could see it happening in the future.
What other patients around your age, would you say it's easy for them to travel to somewhere like where you are, a hematologist center ward, where they can be treated, or is not that easy?
It may not be very easy for some patients, um, but they there are treatment centers at all points in Trinidad. So you can go to the nearest treatment center to have your transfusions done. So if you live in South, you can become part of the hematology treatment room there. Or if you are in Central, you can go there, you know. So it's not necessary, I guess.
Okay, would you say the amount of care is similar, or there's
Um,
different types of care depending on where you go?
I think it would vary um, depending because I don't think that we have enough consultants, hematologists in Trinidad to be at each health treatment center. So I think that is one of the things that needs to be improved here. to ensure that we have a hematology consultant present at all the treatment centers. But the patients do have the option, I guess, of consulting with consultants from other treatment centers if they need to.
Is there the possibility of sort of talking with them over the phone, maybe if they're not physically able to travel that distance or go there, or maybe online via email, or you don't have that facility at the moment?
I don't think we have that facility at the moment, but through the society, we try to make those connections um, with the consultants and with the patients or members um, living with IBDs in Trinidad. So we try to get that advice from them as much as possible.
Okay, and just to finish off the interview, do you have any final words or thoughts that you would like to say to the viewers that are watching or the people that will watch later on? Any message that you want to give to the viewers, and also anything on behalf or anything else that you'd want to say as well?
Um, I would just like to encourage everyone, to believe in yourself, no matter what. Like I was saying before, um, even though you may have a condition, you know, just see it as something that will make you stronger in the end. Um, and pursue your goals and aspire to achieve whatever you want to in this life. Um, life is short, and I think you have to try and make the most of it as much as possible. So do what you have to do in terms of managing your condition very well. Take the advice of your doctors, educate yourself as much as possible, and certainly um, just believe in yourself and pursue all your dreams.
Thank you so much for doing this interview. It was great talking to you and getting
Same here.
insight into things, how things with thalassemia are going on in Trinidad and Tobago. Thank you so much.
Yes. Thank you so much for having me.
It was a pleasure. Thank you.
It was a pleasure. Yes.
Take care.
Take care. Keep well.
You too. Bye.
Bye.